there's something very nefarious going on. And, I'm sure you all have heard that the World Health Organization, the World Economic Forum, Bill Gates for sure, there's a desire to reduce the population of the world. And Bill Gates in particular was trying to use vaccines as a mechanism for decreasing the population of the world. So unknowingly, parents are giving their children vaccines, thinking they're helping their child, when in fact it may be there's an attempt to reduce lifespan or even cause death in the process of vaccinating. That's, that could be a conspiracy theory, right? But it seems like there's enough information out there to show that indeed this sort of thinking is out there. Yeah, vaccines can harm you at any age, but you're so much more vulnerable those first 2 years of life, which is why it is just so devastating to our children. Are our children safe in Canada? Not if we keep jamming them full of vaccines those first 2 years of life. I had almost 600 non-vaccinated children born into my practice. I probably had as many who joined my practice who were unvaccinated. So I had well over 1,000 children unvaccinated. Most pediatric practices might have one or two or none because they kick them out. So they don't get to see what I saw. And what I was able to see and then publish was how incredibly healthy unvaccinated children are, how rarely they get sick. And when they do get sick, they recover quickly. Parents out there, you don't need to fear infectious diseases if your child has a good immune system. And a good immune system just requires adequate nutrients and avoiding toxins. And while it's harder and harder to avoid toxins, if you're vigilant, you can. Drink filtered water, eat organic, and sometimes you take a supplement if there's certain nutrients you just aren't going to be able to get from your diet. And you can have healthy kids, and you don't have to be afraid of anything when it comes to infectious diseases, other than be afraid of those toxic shots, the so-called vaccines.
One last thing, and it's just a kind of an observation, and perhaps you can comment on it, perhaps you can't. I've had the benefit, if you can call it that, of traveling across the country and listening to hundreds and hundreds of people testify, and a lot of medical professionals. And I've heard over and over again testimony from folks like yourself, and I've seen the data, and the data seems to be before us. It doesn't seem to me you have to look very far to see this data. And at the same time, the mainstream, the health professionals, the people supposed to be taking care of us, appear to be unaware or appear to be ignoring that data, even though it's there. And at the same time, we had probably dozens of testimonials from people who proved that the medical profession at the same time were overturning every rock they could in order to find COVID-19 infections. So they were ignoring the data set on one side. And so how is it that the medical profession was overturning every rock to find COVID, but when the data about what they were doing was perhaps dangerous or at least not effective at the very least, they seem to be ignoring that. They have the capability to look, but they don't seem to want to look. Do you want to comment on that at all? Absolutely. It's all about incentives and disincentives. So hospitals were incentivized to, and this was real money, so they were given additional money if they took care of a COVID patient. Then they were given even more money if that COVID patient was in isolation. And then they were given even more money if that COVID patient was intubated, and then another additional bonus if that COVID patient died. So when you have an incentive to have a dead COVID patient, anything that would cause those patients to die would become very lucrative. And that's where the remdesivir and the intubation thing happened. And there are so many horror stories of exactly how they pulled that off. And they demonized anyone who was trying to actually help and make a difference. So they demonized the treatments that could help people,
and they incentivize the hospital mismanagement. And, you know, where do people come up with such evil concepts, right?